everything, definitely shout them out. We'll cover those too. But I'll let Rita Weber with OOD come up first. She wants to say a few words, give you some background about everything we're doing here today too.
Okay, we're good. I think they're going to tape this. Is that like an old word? Is that, can I say tape? All right. Oh God, that's on tape now. Okay, so I noticed from the SALT series that they sent out a link later on, so you'll be able to view this later, and anyone who is not here will be able to view it later. So I think that's great. First of all, welcome. Thank you for coming out on what turned out to be a very wet afternoon. So it's nice to have transportation on an afternoon like this. It's nice to not have to walk or ride a bike, and that's really why we're here. When we talk about employment for people with disabilities in particular, but employment in general, getting there is kind of a critical issue. And so when we ask people, so why aren't you working? What's keeping you from doing that? Transportation is one of those issues that pops up pretty early on in that conversation. And so that's why we're here to talk about transportation. And we've got a nice lineup of folks to talk, and then a great panel of providers. This is just a quick reminder that we're here gathering. It started out through local leaders, which in the early days of Employment First, the counties of Warren, Montgomery, and Greene gathered together to talk about how we could collaborate to really initiate services and programs and look at that philosophy of employment as the first preferred option for people with disabilities. So we worked with employer engagement, and that was the subcommittee that Justin and I and Angela and Linda and a number of us here worked with. And that's what we've been trying to do is gather job developers, employment specialists, and transition coordinators on at least a quarterly basis to collaborate and cooperate and not compete quite as much. And what we've been doing is training, and we've been floating around from county to county, and so today we're in Warren County. Now the next session is due May 3rd. Now that's not quite a whole quarter away, but we want to make sure to get those transition coordinators before they're gone for the summer. So we're a little bit like a month early for the quarter, but that's when we're scheduled again. And we don't have a topic for that session yet, so we're open to ideas. We'll be convening the subcommittee here soon. If you have some ideas, please feel free to email me. I'd love to hear your input. That's really all I had to say. The rest, y'all, if you've been here before, the rest you can go out either of these doors and you'll hit a restroom. So I think that's all I need to tell you about that. Justin, who will be speaking with us, and Bill Blumenhorst also about driving as one of those alternatives for transportation, and we'll be introducing our speakers. So let's get to that.
Okay, thank you very much, Rita. So yes, as a provider too, I definitely want to, as capabilities as a provider, we want to point out too that we're big on collaboration too. So however we can all best work together is what we're all about. So our first speaker today is Bob Steinbach. He's the Director of Sustainable Solutions and Transportation Alternatives with the Miami Valley Regional Planning Commission. He's going to discuss some transportation options and outlooks for the future, and also the 5310 grant. So Bob, you can come on up, we'll get you going.
Again, my name is Bob Steinbach. I work for an organization called the Miami Valley Regional Planning Commission. We're the federally mandated transportation planning organization for Greene, Montgomery, Miami, and northern Warren counties. Now, you can tell I've said that a few times. We primarily plan bridges and roads and are a federal pass-through agency for funding. You'll notice my title, the second half of it says Transportation Alternatives. So basically, in our region, anything that isn't a private automobile is considered a transportation alternative. I'm going to ask you what sounds like an obvious question. I want you to raise your hand in response, and then I want you to look around. How many people drove here in a private automobile today? Raise your hands. Now look around, all right? How many people were by yourself in that private automobile? Okay, that is by far the default choice for transportation, not only in the Dayton region, but in the Western world. In the United States, for sure, there are places it's less true, places it's a little more true, but we almost all drive by ourselves every place we go. Now, one of the things I think is humorous about my title is under transportation alternative. One of the transportation alternatives is walking. Now, if you think about that, that's kind of the original transportation, but now it's considered a transportation alternative. When Rita talked to you initially, she said it's good to have transportation, not have to walk or bike someplace. So we don't even, by and large, think of walking as a form of transportation anymore. So, when I was asked to do this, I made it clear that I don't have any real good solutions for things, but I do kind of have a handle on the challenges. Again, our region is very automobile dependent. We don't have a subway system, we don't have a light rail system. Our houses are spread out from each other. There's lots of areas that, even if there is a transit area that serves that part of the geography, it's a demand responsive transit system. There's no bus stops. You can't just jump on a bus. So we're really auto dependent. Another thing that you can see happening, it's going to happen more, is the percentage of seniors and people with disabilities is increasing in the region. I don't want you to take that out of context. The reason the number of people with disabilities is increasing is largely because the number of seniors is increasing. It's not that there's an upswell of people with disabilities moving into the region. It's that disability and age track together. So it's a challenge now. It's going to be a bigger challenge. I'm 65. I drove here by myself. 15 years from now, yeah, I don't know. I don't know whether I'll still be able to drive. And I live in a place where I'd be fairly isolated if I couldn't drive myself. Non-drivers have very limited options. As far as I can tell, I'm very interested in hearing from the transportation providers. I'd like to know about all the options that are out there. But compared to drivers, non-drivers have very limited options, especially in rural and suburban areas. Not telling you anything you don't know. The need for dialysis and other recurring medical treatments is growing. So what transportation infrastructure there is, there are life-saving appointments that people are having trouble getting to right now. And again, it's only going to get more extreme. And for many people in our region, access to transit is limited either due to location capacity, schedule, or infrastructure. Infrastructure, that last one, even if there's a bus stop down the street, there isn't always a sidewalk with the bus stop down the street. Believe it or not, there are still sidewalks without curb cuts in them in our region. That even though the ADA has been around for quite a while, there are still places that haven't put curb cuts into all their sidewalks. So transportation outlook, I was trying to check in with people. I know in Montgomery County, my office is in Montgomery County, I work in downtown Dayton. We run a transportation coordination council there. I'll tell you a little bit more about that later. I know that in Montgomery County, the Montgomery County Board of Developmental Disabilities is accelerating its transition out of providing transportation due to Medicaid regulations that I'm sure you're familiar with, where the Board of DD can't provide the service and provide the counseling, and provide, all that kind of funding stream, and so it has to somehow be privatized. And so just last week, 2 weeks ago, last week, we had Kamar Gage from Montgomery County come down and talk to us about their attempts to accelerate the privatization of transportation. A few years from now, the board has to be all the way out of providing that service directly. That's going to be a real strain on the system in Montgomery County, because right now, Medicaid transportation to medical appointments is already a strain on the system. Finding enough private sector taxi cabs and medical transport services and so on to get people to doctor's appointments is a big strain. So now, adding to that, trying to privatize employment transportation and all the other places people with developmental disabilities would like to and deserve to go is going to be a real challenge. In my limited experience, as this funding transition takes place, it's easiest to find transportation providers who can do group trips, who will do group trips, say from a group home living situation to a group work site, because the funding is better. The challenge, a lot of transportation is now being billed back to Medicaid, so people have to become certified Medicaid transportation providers and so on. The challenge really seems to be scattered site job placements. Is that the right terminology for scattered site? Pardon?
Community employment.
Community employment, where one individual is going to one job someplace in the community. That seems to be the biggest challenge. Raise your hand if that seems to be the biggest challenge to you. Is that a big one? So, how many private providers choose to get into that market is going to be an interesting thing as this transition goes on. I think a couple of the panelists later are doing that kind of transportation, and I'll be interested to hear what they have to say about it. Then the last thing, when appropriate, access to fixed route transit and travel training can really increase independence. We have a couple of folks from transit agencies that are going to be talking to you, and that really is a good option, one good option for a certain percentage of folks with disabilities. There should have been a map in there, and there wasn't. Okay, so I'm going to tell you what the map was. I think I added that after I said the. So I have a really nice map. It's here on this piece of paper, which is a printout of the PowerPoint. I thought I was going to. And what the map shows is the development pattern in this part of the world from 1950 through a projection to 2020. And you're just going to have to visualize this with me. If you're my age, I was born in 1950. It shows a dark brown core, which is the city of Dayton, the city of Springfield, kind of the little city of Xenia, and everything was nice and compact, okay? And then it shows 1960, and it spread out a little bit. 1970, it spread out a lot. 1980, it spread out even more. 2000, and then the projections for 2020. The next slide, which I'm also noticing isn't in here, talks about the population per square mile within what's called the urbanized area of the region. In 1950, the concentration of population, there are 5,500 people per square mile in what was considered the urbanized area. Urbanized area just means where you have development. Okay? In 1950, it was 5,500 people per square mile. In 1970, it was 3,100 people per square mile. In the year 2000, it was 2,000 people per square mile. And the projection for 2030 is 1,500 people per square mile. Now, what that means is that we're moving farther and farther away from each other. And we're also moving businesses farther and farther away from each other. And those businesses are where you're trying to place employees. Now, the interesting part of that map, you'd really like it if you could see it. The interesting part of that map is that dark brown area, the 1950 area, is basically the footprint of the fixed route transit system, of the bus system. And if you drove through Dayton and you drove through old neighborhoods in Dayton, you'll notice that the houses were really close together. Okay, can you picture a neighborhood, either in Cincinnati or in Dayton? Picture how close the houses were together? You know why that was? Because it was a trolley town. Okay? Most people transported themselves, not in a private automobile, but on a trolley or later a bus. And so, to keep the bus stops close together, to keep access to the bus stops easy, the houses were all built close together, and you walked at the end of the block, you got on a bus, and you took the bus to NCR where your job was, right? Now, as we've gotten increasingly auto-dependent, that is just spread out and spread out and spread out. Now, those of us who are able to drive don't think much about that. You know, the car is kind of like a magic carpet. And you get in it, as long as you plan your trip correctly, you get to work on time. If you can't drive, I'm not telling you anything new, it's just a different way to think about it. If you can't drive, it's a completely different world out there. So one of my job responsibilities is to run what's called a Regional Transportation Coordination Council. This is a federal mandate to allow you to get certain kinds of funding. I'm going to talk about that funding in just a minute. You have to have a transportation coordination plan, and you also have to have an active Regional Transportation Coordination Council. And I'm right now inviting anybody that's interested to come to our next meeting. I left some business cards out there, and I can get you on the mailing list and so on. The people who come to that council are transit agencies, nonprofits, primarily nonprofits whose clients need transportation, but also nonprofits who provide transportation, and for-profit transportation providers. We also have people who use or buy that kind of transportation. We have advocates and individual non-drivers who come to it. We had about 55, 60 people at our last meeting. We're trying to get more people from the medical community to come to those meetings, primarily because you can't treat somebody if you can't get them to your office. We have folks that are just interested citizens. But one thing that everybody has in common, if they want to apply for something called Section 5310 funds, again, I'm going to tell you a little bit more about that in just a minute, you have to be an active member of that coordination council. And the last thing I want to mention is something called MiamiValleyRideFinder.org. If you're not familiar with this website, it's a website that provides information about nonprofit and public transportation alternatives in Greene, Montgomery, Miami, and northern Warren counties. So it's got contact information for senior centers that provide transportation, all the transit agencies, a variety of other volunteer kinds of transportation programs. Section 5310. There are three groups that the federal government recognizes as transportation disadvantaged populations. That sounds like a federal government term, doesn't it? Oh, you said 5 groups. 5 minutes, okay. There are 3 groups. The elderly, people with disabilities, and people in poverty. Now that Venn diagram up there doesn't try to be proportional, but there are lots of seniors who are in poverty, and there are lots of people with disabilities in poverty, but they don't always overlap. The elderly and people with disabilities are the targets of the 5310 program, which is also called Enhanced Mobility for Seniors and People with Disabilities. The role of the council that I mentioned earlier is to share information, ideas, and challenges, and raise awareness about the issue of transportation for those populations. It's like this group, and also another role is to give you the opportunity to network with other interested parties, other people in the same business. We try to identify new and better transportation solutions. We identify opportunities for coordination, try to identify the lowest cost, most appropriate way to get somebody someplace. There are real big misuses of transportation dollars, where somebody is being transported in an ambulette and they don't need an ambulette. The biggest misuse is when somebody uses an ambulance and goes to the emergency room because they couldn't find a way to get to the doctor. It's a hugely expensive thing. And then the last thing is to provide input and guidance to coordination efforts in Section 5310. One of the reasons I have good attendance at my meetings is you have to come to them or you can't apply for the funds. That group has identified these priorities: increasing the need for repetitive medical transportation like dialysis, the growing transportation needs of seniors, transportation needs that cross jurisdictional boundaries, county boundaries primarily, making transit more accessible, transportation needs of low-income individuals, especially those living in suburban and rural settings, which is the hardest to serve, and an emphasis on coordination among agencies. Section 5310, which I've mentioned a couple of times, it's called Enhanced Mobility for Seniors and Individuals with Disabilities. The primary focus is to provide vehicles for nonprofits who provide transportation to the target audiences. These are accessible vehicles. You've seen lots of agencies operating these vehicles. We make the regional decisions about how to spend those funds. Our top priority last year was to maintain and improve the fleets of existing 5310 agencies. There are a bunch of them in the region. Second priority, provide accessible vehicles for other coordination council members that currently serve these populations. And there are some requirements to get the funding. You need to be in good standing, and that's what that means down there. Now this I think this is my last slide. This is a map. It's not the one I was referring to earlier. This is our service area. Again, Montgomery Greene, Miami, and northern Warren counties. It's hard to see, but the little dots on the map are the 11 agencies who received funding for 5310 vehicles last time around. Since we're in Warren County, I want you to note that when we see northern Warren County, we're really talking about a tiny slice of northern Warren County. It's basically Franklin and Lebanon. But if you are situated there, you need to become involved in our coordination council if you're interested in learning more about the 5310 funding. And I think I'm done now, unless somebody has a quick question for me.
Do you ever get employers? I mean, would that be a population because they want to get people to where they are? They're not located on a bus line?
We don't tend to have employers as much as we have people who are trying to place folks with employers. Yes?
Is the 5310 just for a nonprofit, or do you also?
It's for nonprofits or government agencies to provide vehicles for those agencies. There are places in the country, we're not doing this yet, that you can use those funds to contract with private sector organizations. There's lots of paperwork involved, and we've just been given this program to manage in the last year, and so far we have decided not to go in that direction yet. Anything else? It's got a hook over here.
Thank you very much, Todd. All right, so next we have Brady Sella, the self-advocacy representative from UCEDD. He's going to discuss the SWAT initiative. It's a Southwest Ohio Regional Transportation Work Group. So come on up here, Brady, and we'll get you going.
I think that ramp was a little steeper than I anticipated. So I'm Brady Sellett. I work at Cincinnati Children's Hospital for the USED, University Centers of Excellence in Developmental Disabilities. And we've started a group within the USED SWAT, and we call it Southwest Ohio Transportation Network. And so the purpose of SWAT is it's a group of different providers and different agencies. We share information about regional transportation, the different transportation options, and we learn about and discuss unmet needs for individuals with disabilities and others who can't drive, and to discover possibilities and creative ideas to help non-drivers get to work, medical appointments, and do social activities as well. So, okay, any SWAT members, any regional community partner is welcome to be a member who is passionate about improving transportation options for everyone. We currently have 74 members and 37 organizations. And there was a few of the different organizations. We have Metro, UTS, Warren County PD, Community First, OKI. So we have, within the larger SWAT group, there are 3 smaller groups. We've divided into 3 work groups. And the first group is focused on mobility management systems. The second group is transportation provider consortiums. That's their main focus. And the third group is focused on transit provider trainings. I'll tell you a little bit more about those. So the first work group, mobility management system, they're tasked with setting up a mobility management system in the region, a one-click access to transportation options, and we're working to develop a transportation database. We're looking at an innovative approach for managing and delivering coordinated transportation services to all people served by SWAT. Just going to use the slides. So the rest of identify what this service would look like and how it would look to feel from a user perspective, identify the parties necessary for its success, government administrators in various geographic regions, service providers, representatives of various other users as well. And the last is to identify the barriers to doing this. We're looking at laws, codes, policies, various organizations, perceptions, and people, and the brainstorming solutions. Work group 2, Transportation Consortium. Transportation providers partners to address current gaps in service areas. They look to identify specific gaps and identify underlying issues that is contributing to these gaps. So what the gaps are and why are they there? And work group 3, training transportation staff about providing outstanding service to customers of all abilities, drivers and schedulers. So not just the heads of the various agencies, but also the drivers and the schedulers. And we are using a group, a SOAR, starting our adventure off right. And SOAR is part of a LEND program that we offer at the USED, and a model and they look at program as model and utilizing and duplicating. So we don't duplicate things. Create a marketing plan and start a training program. So, and the next steps for SWAT would be to strengthen SWAT, continue to grow SWAT members to have regional reach and impact, and participate in there's a transportation summit in Columbus this summer, and we plan to participate in this. And yes. This is my coworker Kara.
Yeah, hi everyone. I'm Kara Ayers, and I'm the Associate Director at USED with Brady. And I asked if I could tag along today as well to share a little bit of what we're doing also on the policy side related to transportation. I know that Bill mentioned the misuse of ambulettes and how that's a real significant problem. And so one of the things that we're proud of our SWAT members that they've done is branched out and advocated in changing some of that policy to kind of open up taxi options so that if taxis were transporting people with disabilities, they wouldn't have to qualify as an ambulette. So I think that's one of the real strengths of the SWAT that's hard to kind of capture as we're trying to break it down by work groups is it's been established for a couple of years now. And so not only do the members do great work when they come together, but separately when we kind of go off into our own entities, there's a lot of work going on as well. And within the SWAT, we have self-advocates represented, we have families represented, we do have providers, and I was trying to think with the question, Rita, you had about employers. I don't know if we have anyone who is there like only representing a role as an employer, but I definitely think that we have members that are also employers and see that as an issue. So one of our hopes for today was that you would feel comfortable to ask anything about SWAT, and also that if anyone is interested in joining us, logistically we tend to meet down towards Children's Hospital, although we're exploring our next meeting might change locations and be at Starfire. So it's really a great opportunity if you have a passion for transportation, which I'm hoping most of you do, being here this afternoon. So we would love to have any and all of you all join us. But we do have a couple minutes for questions.
Can you talk a little bit more about the database? Where you're gonna house transportation options and, like where you stand with that and where you might be housing that?
we are exploring that right now, where we would house something like that. We do have a list of the various different transportation providers currently, and we're looking at where we can house something. So we're trying to figure out where that would be housed, and also updating it as we get more information and new providers come along. So.
But what does LEND represent, L-E-N-D?
LEND, LEND stands for Leadership, Education, and Neurodevelopmental Disabilities. Yes.
It's an interdisciplinary training program at Cincinnati Children's, so it has graduate students and postdocs, and they spend a full year in addition to their clinical and research training. So some are psychologists in training, some are genetic counselors, some are developmental pediatricians, and other disciplines as well. And so they spend a year of intense focus on disability every Tuesday and Thursday, so they do didactic sessions. And so they learn about things like transportation as a barrier to employment, and are strong advocates to that. And the SOAR program is really exciting. It started out by training airport employees of the airport, of how better to assist families who wanted to travel, primarily with kids with autism, and now it's expanded to other disabilities as well. But we realized that model of training the community to be better prepared to work with people with disabilities and their families was a missing component. Sometimes I think we focus our work at Children's on preparing the children and the families, and so we realized that we were missing the piece of training the providers, and we also see that among transportation providers as well, everything from schedulers to drivers to providers and so on.
So the information that they derive from their efforts, how do we as providers gain the benefit of that?
From SOAR,
Or LEND?
Lynn, you could definitely be in touch, Brady, or I could connect you, and I think, did you leave your cards by this slide? So Brady left his cards by the slides out front. You could get in touch, and yeah, they have a number of partners ranging from like the Cincinnati Opera to the ballet, that the ballet wanted to put on a sensory-friendly performance. So it's not as much, necessary to be specific of the organization. It's more they figure out what that organization needs in terms of training and how they can help provide it.
I wanted to mention, that's one of the nice things about SOAR is we're realizing that the group with SOAR is realizing that it's not just about, going to the airport. There's other things that people want to experience, and we are actually starting our next project, or our next initiative will be working with the Cincinnati Children's Museum at Union Terminal for a night to experience the Children's Museum. So.
Is there a program like this also at the Dayton Children's Hospital?
I don't believe so.
There's another land in Columbus at Ohio State Nysonger Center, but SOAR is actually unique, started here.
Yeah, SOAR is unique in Cincinnati.
So are you only covering the Cincinnati area at this time? Is that your region right now? Or is
No,
it
you said it's
expanded a little more?
statewide.
Pardon?
You said it's statewide.
It's statewide?
Yeah. SOAR is more local, but you said, yeah. Any other?
You might have been 5 minutes ahead.
Thank you.
right, so thank you very much, Brady. Some good information. I don't know, I definitely want to dig more into USAID to see what all they're doing too. So looks like they have some good initiatives going on though. So next up we have Bill Blumhorst, capabilities. He's going to discuss drivers training programs and how people might be able to drive themselves. Since, as Bob pointed out, we are a society really based on a lot of people driving themselves. So we'll let Bill kind of speak on that.
You can be my clicker.
Oh, good.
All right, learning to drive, is it a good option? A lot of people are possibly thinking about this as a possibility, and we like to encourage you to give it some thought. Hopefully we can give you some ideas to think about here today. Is the person I'm supporting a good candidate to get their license? Some things to think about. Is the person mature enough to realize what their actions are doing? Are they able to problem solve situations? Do they have any substance abuse issues? Do they have any medical issues such as seizures? Which if a person does have a seizure, they are limited to not driving for a year after having a seizure. Is their family supportive of their driving? A big important part in the driver's training aspect of it is, if they have family support, do they have somebody to practice their driving with beyond just the instructors? Do they sleep enough to be alert while driving? And obviously, how is their vision? Is the person I am supporting a good candidate to get their license? Some providers of driver's education offers driver's evaluations. Certified professionals will assess a person. Does it say if an individual is a good candidate for driving? Can it include how many hours of instruction it would take? Can it be on the road evaluation if the individual has a permit? And can it be a simulated assessment, or is it a good option for some people? Sometimes the driving simulators, we work closely with St. Rita's Hospital in Lima, and they do have a simulator there, and a lot of times, especially with older people who are not used to let's say a video type of response, they have a lot of trouble with the simulators, where a lot of times they may not do that well in the simulator, but then they'll, St. Rita's will a lot of times refer them to us for an actual behind the wheel evaluation. A lot of times we find that they do a lot better when they're actually behind the wheel of a car. Okay, things providers can do to help gauge if someone is ready for a license. There is a sample test on the Ohio BMV website there. A very good idea to take a look at that and kind of go over those questions. Drivingtest.org has road sign sample test. And drive around and look at road signs and have that individual tell you what the signs mean. Have individuals how they should react to them. And if they do well with this, go ahead and test for a permit. And it can always, we can always retake it if needed. Keep in mind, a permit, if they go in the first time and take the permit test and do not succeed, it's not that uncommon. And if a person has multiple times tries to take the permit test and does not succeed, there are some exam stations that you can request an oral test read to you. In other words, the examiner will sit and read this test, and then it's a true-false version of the permit test. Now, not all exam stations will offer that because it's a time. It takes a lot of time to set that up, and you do have to set up an appointment with the examiner to do this. So I just want to point out that not all exam stations will do that, but if somebody is struggling many times, it usually can be worked out with an exam station. It may not be the local one, but there's an exam station in the state that you could schedule that, and it's a lot easier to prepare for that test too, basically because it's a true-false test. Okay, now we offer a pre-driver's education service. In this, we assist people to prepare for passing the permit test. We use methods that have helped many people get their permit, and it helps to hear it from a different source at times. In other words, if a person's struggling to get their to get through the permit test, one thing I would suggest, if you have a person that's going to take the permit test, have them if they first of all have the mic on so that the test is read to them as well through the computer when they're sitting in front of the computer. If they're taking the test and as they're going through, if they come up to a question where they're really not sure of that question, encourage the person to skip that question and then go on and answer the questions that they know first. There's a bank of 50 questions that they have to answer. They need to get 38 of those questions correct. And once they get to the 38th question correct, they're done. So what can happen here is you could skip some few questions, and then as you get to that point, you may have to come back to that question and answer it. But at that point, you've got all of these answers correct that you know about, and you have a lot better opportunity of passing that test. So it's a way of kind of getting through that first step, because the real meat of it is to get the training once you get your permit. Okay, as I talked about the reasonable accommodations when testing, use the headset. And as I talked about, as requesting a scheduled time with examiner, and again, not all exam stations do allow this, but if we look around, there are several of them that do. Okay, you get your permit. Oh my God, now what do we do? Well, first of all, keep in mind, the permit is good for 1 year. So we don't need to rush into anything, but at the same time, we need to keep the process going. So if you're under 18, you have to take a driver's education course. Now, the state now does offer an online education course where you can go online and do the classroom part of your program. After getting the classroom program done, you then have to contact a driving school and get your 8 hours of behind the wheel training done. So keep in mind, the online is another option of at least getting the classroom done where you don't have to actually go to a driving school. But you still have to get the 8 hours of driving scheduled with a driving school. The online program normally is around $100 that you need to, the cost of that. The full class option, obviously, go to call a driving school up and do a classroom, and there's many providers that provide that service. And if you're over 18, you do not have to take the 24-hour classroom. You just have to pass a driving test. Obviously, you want to do some preparation to get that done, though. Okay. We recommend on-the-road driving. Instructors with capabilities have certification to drive with people with disabilities. We've gone through the state offers a training program that gets you up to date on some of the medical issues and some of the techniques in using in training people with disabilities. And we have, right now we have 5 instructors on staff that are able to do that at capabilities. But there are other driving schools that are certified to do the same thing. And generally we have found that most people with disabilities, if they have a family member that can also work with them, we generally average around 20 hours of behind the wheel training. It obviously depends on the person's ability to if they're a calm person, if they don't get real nervous, they tend to get through things a little better. But if it's a very nervous person, then we've had people that start out, okay, they get in the driver's seat, they look down, okay, now which one's the accelerator, which one's the brake? And we've started at that point, you know, and somebody that's that nervous about that situation, obviously it's going to take a little longer. But on an average, we expect to spend around 20 hours behind the wheel training. Okay, what kind of access to a car do you need to get a license? Okay, if you're in a driver's education service, it's good to have a licensed driver over 21 that can ride with the person with the permit. It's not necessary, but it gives a higher probability of success. Obviously, you can do more training, and it keeps you fresh in between the driver's lessons, with the instructor. This replicates what is done. It is if a person is under 18, if a person that's under 18, they are required to do 50 hours of driving with their parents. So with capabilities, we allow students to test in our vehicles. In fact, that's the preferred method. Once we bring a student on, we like to see them through until they get their license. And a lot of times they get a lot more comfortable with doing the maneuverability procedure in our car, and they get more comfortable in our car, and they're more relaxed. And we kind of review some things just before test time, because that's usually a nervous day. And if we kind of get their nerves calm as possible just before testing, they tend to have a little bit more success. Okay, down there, if you're going for a license without driver's education service, remember, practice with a licensed driver over 21 once you have a permit. Okay, what kind of insurance do you need? If you are in a driver's education service, there is no insurance. The driving school has that covered. But you need to state that you have insurance when you purchase your license. So remember, when you get to the date of passing your driving test, you will need to have insurance in line then. And if practicing with a licensed driver over 21, need to let that person's insurance know that what is going on, just so to make the insurance company aware of it. If you're going for a license without driver's education services, again, practice with a licensed driver over 21, need to let the insurance know, and need to state that you have insurance when you purchase your license. Okay, other services we do offer a first-time driver safety course. This kind of came up. We were getting cases referred to us that the people were, how am I doing on time-wise? What you looking at? Okay, good. Talking fast enough. We were getting requests from the OOD services. We were getting cases in that people were over 18. They had never gone to a driver's ed course. They never experienced any of that. And they were wondering if we could kind of come up with a kind of a condensed version of a 24-hour classroom. So what we came up with is a 8-hour, one day, where we bring the students into our classroom. We do a condensed version where we're really talking about the responsibilities you're taking on, getting ideas of some of the maintenance stuff they're going to have to be realizing with their vehicles, and really trying to just focus on the responsibilities of what you're going on. So during this 8-hour course, we also do an evaluation of the person that's there, giving an estimate on how many hours it might take in getting training done to get their permit, and also get their license. And again, we really go over the responsibilities and consequences of some bad driving, what could happen, you know, and we try to really point out some of we try to point out the good things, but also point out some of the real consequences that could happen if you don't follow through with good driving practices. Okay, how can the driving services be billed? Through a Medicaid waiver. It does pay some of it, but it does not cover the entire cost. The balance can be paid through a student or family responsible for the remaining amount. Questions? Yes?
How do you instruct deaf consumers to be on the road?
We go over, we got some real basic hand signals that we do. We never want an interpreter in the car with us. The only time we may get an interpreter involved in doing the maneuverability procedure, we may get an interpreter involved at that point just to kind of go over what we're going to do when we talk about turning points. Other than that, we talk in the car, we communicate with basic signals as, raising, accelerating, slower, and then making a left turn. We'll do a hand signal right, and it's real basic, and we've had very good success with it.
Can you work with the state of Ohio so that the deaf can get CDL certified during that same time?
I'm sorry, say that again?
Have you ever talked to the DMV in Columbus about accommodations for individuals to get their CDL who are deaf or hard of hearing?
We haven't done a lot with CDLs. We have assisted some in getting some permits through for the CDL, but going any further than that, no. We've tried to work on setting up a bioptic. I know that's not where you're going, but we were trying to set up a bioptic program, and we were hitting a pretty solid wall with that. So I would like to say I would like to approach them more, but I understand your struggles. But we do really work with examiners, and I will say this. There's a big difference where some of the exam stations where you take some of your students. There's some exam stations we avoid, and there's some exam stations, and that's why.
Especially for CDL.
It carries on for everything, to be honest with you, because these busier exam stations, some of those examiners have been there for a lot of years, and they're struggling with a busy schedule, and they're not willing to take the extra time and patience. There's other examiners that are just, they're just great. And it's just like anything else, and so you kind of look for that, and it's not that we're looking for a place that is going to cut our people any slack. We're not saying that, but we want to make sure that they're giving them a fair break too. That's really what we search for, and we found a lot of very good examiners out there. A few bad ones. Yes.
I can imagine that sometimes there's going to be quite a struggle in terms of trying to decide whether this individual really has the response time, all the abilities to understand the rules of the road, what needs to happen. Maybe the struggle between the person maybe cutting themselves not enough opportunity and setting their bar too low, or maybe they're setting the bar too high and they haven't understood what's really out there. You mentioned you had some people that are kind of experts in walking through that. Do you have any stories about that or something that?
Oh, I've got several stories. The big thing I would encourage is to encourage the people to get their permit, because quite honestly, you can't really tell until after you get them on the road. And I have a pretty good idea, but I always like to give everybody the opportunity. And just because they have a permit, that doesn't give them a license to drive. It does give them the opportunity to learn to drive. So I encourage everybody to give them that opportunity. I'll share one quick story. I had a person that was using hand controls, and we have a car equipped with that. And this person was wanting to get a job at the local Walmart store, and she needed to have transportation to get there, and was living out in a very rural situation. And we got in the car, and we did some driving, and I'm sitting in the passenger seat over here, and she's making her turns at intersections, and when she would turn, keep in mind with a spinner, with a hand controls, you have a spinner knob on the wheel as well. And this student would make her turns, and when she would make her turn, she wouldn't recover the wheel, so we would kind of go off onto the shoulder of the road, and I'm over here pushing that steering wheel back, you know, and I thought, okay, this isn't working. She's relying on me to turn that wheel. So we're in a very rural situation, and she makes this turn, and I've looked ahead, and okay, this ditch is good here. If we go out in this field, this is not going to be a problem. Well, we turned, we went out in the field, and we stopped and we talked about it, and I said, now see, this is what's going to happen if you imagine if there was a car here, you'd have hit this car, or you know, whatever. And for some reason, being out in that field really hit it with her. And she never failed to not make that turn again. So to recover that wheel. So sometimes you've got to go through some of these experiences. Obviously, you don't want to do it in a high traffic situation, but we were fortunate in that situation. And there's other stories I can give you, but that's the type of situation. You've got to experience some of this stuff. Give that person an opportunity to experience it, but be prepared to take over that wheel if you need to. We're fortunate we got a brake on our side. We've also done in some situations, we put a passenger side brake in a parent's vehicle as well. If they wanted to do extra training, it can be done. It's not really that expensive. A couple $100 can be spent, and you can get a passenger side brake in a vehicle if a person wants to do that. So it's another option. So I really encourage, if you've got a person that you're thinking about that, let them try to get that permit. Let them work on that. And if they get that permit, let's see what happens. It may be determined that it doesn't go anywhere, but boy, it sure opens up a lot of doors if we can get it done. And maybe they'll even take 2 people in the car.
Thank you very much. Great, I'm just gonna pull up mine. I've got a quick little bit about Uber. Has anyone ever taken Uber before? A few people out here. Oh, good. I was actually an Uber driver for about 3 months. So interesting experiences I went through. So I just wanted to kind of let everyone know the whole process. If you've never taken Uber, we'll go through it pretty quick though. So the things you need to do, sign up for an Uber account and to be able to take rides is a credit card, a smartphone. They work with Android, iPhone, Windows, any of those ones, and then an account. So you have to go to the Uber webpage to get the account, or you download the app and you can make your account that way too. So to set up the account, I'm going to flip through these pretty fast because basically you either go to the webpage or you pull up the app, and once you get there, you do sign in. And but once you get there, you do need to sign in and have an actual credit card and payment. So these are all the things they ask. So if you have those, you're good to go. And then you download the app actually on your phone too. And signing in is a pretty easy process too. All right, cool. So to make, one thing I found out from being a driver is some people didn't use the location services on the phone to point out where someone is. It always helps if you physically type in what address you were really at. So if you do it, you can kind of click this little circle here, and you could point it. So I put it at 801 Drake, and yesterday when I checked, there was a driver available to pick up. They were 5 minutes away. Now there were a couple times I checked here, there weren't drivers available, so it's all dependent on how many drivers are around you and how many people could be there too. But it always helps if you put that address in. But you can always just hit that geolocation, and it's going to be a good enough spot to usually be able to get you, though, too. Because usually what drivers are going to do, if they can't find you, they have the access to be able to call you or text you, and you can talk to them that way, and they can tell you, too. You can get a fair estimate too, so you can find out how much it's going to cost. So once you plug in that address or where you want to go, you just hit the spare estimate down here, and then you enter your destination, and it'll give you an estimate. So when I did it from my workplace, which is on Woodman Drive in Dayton, to my home in Miamisburg, it's going to be $18 to $24. at that time yesterday. That could fluctuate based on what the demand is too, so, but you can find an estimate of how much it's gonna be. So that's about a 25-minute drive usually, so it's not too bad. Then you can actually just request the ride by hitting that button. They have a big initiative for low vision and blind users too. Well, they did say there's an advocate that Uber is the biggest single advancement for the mobility of blind people in the past decade. So it's for people with visual disabilities or hearing loss. They make it really simple to be able to use it and compatible with everything. And also, if you're deaf, I mentioned you could text the drivers, and you could text them as you're sitting there right with them too. And you plug in your address. So there were some. I drove some people that didn't speak English sometimes. That made it interesting sometimes too. But yeah, you can plug it in, you're good to go. They also make it, if you have a disability like hearing loss, they make it really nice that you can be able to drive. It alerts people that are getting in the car that, hey, this person's hearing loss too. It's a good option for people that way too. I did it just because I have another baby on the way, so needed a little extra income. So it was a way that was flexible for me that worked. So that's the way a lot of drivers are, I found out too, with other people. And for the safety for the riders too, the drivers do have background checks. They run social security traces, so they don't do fingerprints, but they do a social security trace. So the big thing they're looking for is if you have any DUIs or OVIs on your record. And you can also set an emergency contact in here too. I thought if you have a developmental disability, this could be really important because what you do as you're, this is what it looks like when you're in the car with someone. You could send a status to contacts and send an update of when you arrived, when you're supposed to be there, and so that way they know everything. So if someone can generally use a smartphone, they make it pretty intuitive how you do it too. And you could always practice with someone to do it before you do it on your own too. There's an Uber Assist. This is designed for disability communities. And now it's not really in Ohio yet, but there are quite a few cities. They make it, this one's for elderly people and people with disabilities. So they don't have lifts in these cars, but they do have, if you could fold up your chair things, you can put it in there. But they don't have accessible ramps. There is Uber Wave, and this is in some other bigger cities now too. This recently went to Toronto. I saw some things about that. And these actually do have lift vehicles. So they're starting to get into more of these things too. So I'd keep an eye out, and eventually it'll get here, I would believe. But it just takes the right kind of infrastructure to get it there. All right, and so there is a new, if you want to be a driver or if you want a free ride, there's an incentive. You put this referral code in, and you can actually get a free ride. I think it's up to $15 you can get off your first ride. It might be a free ride, and you can actually get up to $75 if you're interested in driving too. Anyone have any questions? General about Uber at all? Yes, sir.
In your time driving, did you notice, I know a lot of times I've used it, it's been more of a social trips. Did you notice any trips to medical appointments or demographics of your riders?
Yeah, I drove at night a lot of times, so with a lot of people coming home from bars. I think that the time that I was going and the locations I was going by the Oregon District in Dayton, so I was going to expect that. But also down by the Dayton Mall too, I got some college students who are maybe going there and taking rides back home then too. So depends what time of the day you're doing, in what area. They also put out like events, so if you know events are around, you can kind of drive around and know those too. So, yeah.
So they don't do cash?
No, it's all cashless. It's all done through a credit card. They say you're not supposed to tip a driver. Usually drivers do accept tips, but you don't have to tip them at all. They're not going to frown at you.
Do you use a debit card or does it have to be a credit card?
You can use either one.
Okay.
Debit or credit. Yeah.
I noticed in some of the bigger cities, they're using them for like first and last mile with the public transit agencies. Did you find that as a case as a driver on Dayton?
It's funny, my first drive that I had was a guy going to, he was from his workplace in Miamisburg. He was working at a nursing home. I dropped him off at the RTA hub. Other than that, out of 200 drives, that's the only person I ever had to do that though. So some people did, yeah. I think I also drove when it was usually good, it was warm enough to walk. I think if I would have get more winter time, that would be more of a thing. Other questions?
If they have like a set work schedule, have you ever had someone like set it up, like, can you do this every Monday, or is that not something?
Yeah, it's up to the driver. If you get a relationship with the driver, like I'd be comfortable giving up my phone number to people, but you can't like schedule anything, but you could say, hey, if you like this driver, say, you can text them and say, hey, would you mind picking me up? And then, so basically when they get there, then you flag the ride, so. All right, well, I think we're gonna set up for our transportation panel now, so thank you very much. All right, so we're gonna break for about 5 minutes, I think, so feel free to get up, relax a little bit, then we're gonna bring up our transportation panel here, and we'll get going with that. Thank you very much, everyone.